I'm coming in hot.
COVID-19 tends to affect men, overweight people tougher. In emergency rooms and virus hotspots around the world, medical professionals see more men than women suffering from serious COVID-19 symptoms, with obesity emerging as another potentially aggravating factor. But experts are still unclear about why. What first started to appear as a phenomenon in China, where the virus originated in late last year, echoed as the pandemic spreads across hospitals in Europe and the United States. More men than women have serious issues, so there is a greater risk for patients who are overweight or have prior health problems, said Derek Hill, professor of medical imaging at University College London. This trend is supported by early figures from the UK's independent intensive care National Audit and Research Centre on people treated for the infection in intensive care. 73% are males and 73.4% are identified as overweight. In addition, obese patients were less likely to survive after receiving critical treatment, according to preliminary outcome results for those patients who had either survived or died of COVID-19 in the time before April 3. After good treatment, some 42.4% of people with a body mass index, BMI above 30 were able to go home, compared with 56.4% of patients with a BMI of less than 25. French emergency rooms have seen a very significant proportion of obese or overweight patients, ICU Dr. Mathieu Schmidt told broadcaster France 2, at the Pity Hospital in Paris, noting that 3/4 of all patients were men. A similar image emerges at New York. "I'm in the emergency room and it's amazing. I would say that 80% of the patients brought in are men," said Hanny Spitney, a reconstructive surgeon at Mount Sinai Health System who handled COVID-19. "There are 4 or 5 patients out there," he told the New York Times. But why do so many men get involved? Just months after the appearance of the new coronavirus, scientists believe it is too early to know for certain. For now, the high frequency of men with more serious symptoms is an observation, said Jean-Francois Delfroussy, who heads the French government's Coronavirus Research Council to advise. Although he said there was no straightforward answer, he raised the theory that men had multiple pathologies at a higher level. "I'm very humble about this virus. I didn't know about it 3.5 months ago. There are plenty of question marks," he told radio station France Info. Some experts say it may not be the weakness of men that makes the difference, but the strength of women's immune system. "Innate immunity is stronger for women, particularly before menopause," said Pierre de Libel, head of the Department of Infectious Diseases at James Gill University Hospital in Toulouse, a local doctor and honorary clinical lecturer at Warwick Medical School. One theory was that women might have a more robust immune system, which means greater resistance to infection. Another, he said, was that the presumption that men really don't look after their bodies either, with higher rates of smoking, alcohol consumption, obesity, adding that the response may be a combination of biological and environmental factors. Obesity contributes to health risks in general, with a rise in the incidence of diabetes and hypertension, both reported in Italian and Chinese research as aggravating factors of COVID-19, along with age and to a lesser degree, cardiovascular and cerebrovascular disease. This presents a great concern for the U.S., where about 42% of adults are obese, according to the U.S. Centers for Disease Control and Prevention, which warned people with BMI over 40 could be at higher risk of serious COVID-19 disease. "We're concerned about our American friends, because they'll probably have more issues due to obesity," Delfroussy said. Thanks for watching. Please like, share, comment and subscribe.